I want you to think about something before you close your eyes tonight. You are about to spend 7 or 8 hours in a position you almost certainly never question. You chose it years ago, maybe decades ago, and it became habit so quietly that you stopped noticing it entirely. And yet that position, the one your body settles into every single night without thought, may be doing something to your blood vessels, your brain, and your heart that no daytime habit could ever fully undo. Tonight, I'm going to walk you through 5 specific sleep habits that put your cardiovascular health at risk while you rest, ranked from the ones that concern me to the one that genuinely worries me most as a doctor who has spent years working with older adults. And when we get through those 5, I'm going to tell you exactly what to do instead. 2 specific positions backed by real science that can begin protecting your brain tonight. My name is Dr. William. I work in preventive cardiovascular health, and I want to ask you something before we begin. In the comments below, tell me right now whether you sleep on your back, your side, or your stomach, because I am going to speak directly to your situation based on your answer, and I read every single comment personally. Here is the number I want you to carry through this entire video. 30% of all strokes in this country happen between midnight and 6 in the morning. Not during a heated argument, not during physical exertion, during sleep. While people believe their bodies are safe and resting, that number is not a coincidence. It is a direct reflection of what blood vessels experience overnight when certain habits are quietly working against them hour after hour. Let us begin at number 5. Number 5 is sleeping completely flat on your back without any elevation. This position feels neutral. It feels correct even. Many doctors used to recommend it without reservation. But here's what happens inside your body when you lie completely horizontal for a full night of sleep. Blood settles toward your head because gravity, which normally helps your circulation return blood downward toward your heart, is no longer doing that work when your body is flat. In younger adults with flexible, responsive blood vessels, this pooling is handled without trouble. But after 60, your arteries have stiffened. The small vessels inside your brain have become more fragile than they were even 10 years ago. When blood pools in your head for hours on end, pressure inside your skull quietly rises. That middle-of-the-night headache that wakes you for no apparent reason is often a direct response to that pressure. Research has confirmed that raising the upper body by even 15 degrees measurably reduces intracranial pressure and improves the return of blood to the heart overnight. If you have ever woken dizzy, lightheaded, or with a pounding sensation in your head that wasn't there when you went to bed, this is the explanation most doctors never have time to give you. Number 4 is sleeping on your right side, and I want to explain this carefully because it surprises almost everyone. Your heart is positioned slightly left of center inside your chest. When you lie on your right side, your abdominal organs, which are heavy, shift toward that side as well. One result is that a large vein called the inferior vena cava, which is responsible for carrying blood back from your lower body to your heart, can experience compression from that organ weight pressing against it. Even partial compression of this vein increases the workload your heart must perform just to maintain normal circulation during sleep. For a healthy 35-year-old, this added effort is negligible. For an adult over 60 who already manages blood pressure, borderline heart function, or early cardiovascular disease, 7 or 8 hours of added cardiac workload every single night is a meaningful cumulative burden. Researchers studying heart failure patients found that left side sleeping was consistently associated with better overnight blood flow stability and less cardiac strain than right side sleeping. And here is an observation I find telling. People with significant heart failure often cannot sleep on their right side without feeling genuinely uncomfortable. Their body is communicating something that the science confirms. Number 3 is stacking multiple pillows under your head. The instinct behind this is understandable. Higher feels easier to breathe. Reflux seems more manageable. Sinus drainage improves. Some elevation is genuinely helpful, and we will return to that. But here's the specific problem with stacking pillows, rather than using proper elevation for your whole upper body. Stacked pillows push your head forward, bending your neck into a position of significant forward flexion. On each side of your cervical spine run the vertebral arteries, which carry blood directly to your brainstem, your cerebellum, and the parts of your brain responsible for balance, coordination, and consciousness itself. When your neck is pushed into extreme forward bending for hours at a time, these arteries experience chronic low-level compression. Research into how neck position affects vertebral artery flow has confirmed that extreme forward bending reduces blood flow through these vessels in measurable ways. The morning stiffness at the base of your skull, the dull ache behind your eyes when you first wake up, the sensation that your neck is locked for the first hour of the day. These are often not simply signs of stress or age. They are signs of a compressed blood supply running through a mechanically compromised position all night long. One properly contoured pillow that supports your neck's natural curve, rather than 3 soft pillows stacking your head forward, is often all it takes to resolve symptoms people have accepted for years. Number 2 is sleeping tightly curled in the fetal position. I understand the appeal. It feels safe. It feels instinctive in the deepest sense. But from a physiological standpoint, this position works against you in 2 specific ways simultaneously. First, when you curl your body tightly, your ribcage compresses and your lungs cannot expand fully. Every breath you take throughout the night is shallower than it would be if your chest were open. This reduced breathing volume means your blood oxygenation drops slightly over the course of a night, which places additional stress on both your heart and your brain. For someone with any cardiovascular or pulmonary condition, even mild chronic oxygen reduction during sleep carries real consequences over time. Second, the muscles along your neck and upper back remain in a state of sustained contraction throughout the night in this position. This tension compresses the small blood vessels running alongside your cervical spine, reducing circulation to the back of the brain throughout your sleep. The foggy, heavy feeling many people experience in the morning after sleeping tightly curled is often not simply a question of sleep quality. It is a circulation question. And now we arrive at number 1. The habit I consider most damaging of all, the one that most directly explains why so many strokes happen in the hours before dawn. Lying down to sleep within 2 hours of a large meal or within 4 to 5 hours of drinking alcohol. I know this is the most personally relevant item on this list for many people because it touches deeply established routines. Evening dinners, a glass of wine with family. These are not small things to ask someone to change. But I want you to understand what is happening in your body when you do this. After a large meal, your body redirects a substantial volume of blood to your digestive system to process what you ate. In younger adults with highly responsive blood vessels, the rest of your circulation compensates smoothly. In older adults with stiffer, less responsive vessels, this redistribution of blood can leave other regions, including your brain, with less blood flow at a time when you are lying down and unable to notice any symptoms. Now add alcohol. Alcohol dilates blood vessels, dropping blood pressure. For healthy, flexible vessels, this is simply relaxing. For vessels narrowed by decades of change, a sharp drop in blood pressure triggers an overreaction. Your body tries to correct by pushing pressure back up, overshoots, then drops again. These pressure swings mechanically stress vessel walls. In places where blood becomes turbulent or temporarily stagnant during these swings, the conditions that favor clot formation become more favorable. And this entire sequence is happening while you are asleep and completely unable to recognize any of it. Finishing your last full meal at least 3 hours before lying down, and stopping alcohol at least 4 to 5 hours before bed, along with a brief walk after dinner, are changes that directly interrupt this sequence. A 15-minute evening walk alone meaningfully improves how your digestive system handles that meal before you lie down. Now let me tell you what to do instead. The first protective position is left side sleeping. Your heart sits left of center, meaning gravity actively assists blood flow back toward your heart when you lie on your left. Your heart works less. Your circulation runs more smoothly. Your brain receives more consistent oxygen. But the piece most people have never heard is this. Your brain operates a waste-clearing system during sleep called the glymphatic system, a network of channels that flushes metabolic waste out of brain tissue during the overnight hours. The proteins most closely associated with Alzheimer's disease, amyloid, and tau, accumulate throughout every waking day. Your glymphatic system is what removes them each night. Research has confirmed that this system operates most efficiently when you sleep on your side, and specifically your left side. This means left side sleeping is not just about tonight's circulation. It is about what your brain looks like in 20 years, what your memory looks like in 20 years, and whether those proteins get cleared out consistently or slowly accumulate toward a threshold nobody wants to reach. I want to tell you about Dorothy, 72, who came to me after 3 consecutive months of waking with morning headaches and describing her sleep as restless and unrefreshing despite spending 8 hours in bed. She was a right-side sleeper and used 2 pillows stacked under her head. We made 2 changes: left side sleeping with a body pillow in front of her and 1 properly fitted, contoured pillow replacing the stack. Within 2 weeks, the morning headaches were gone. Within a month, she described her sleep as the deepest it had felt in years. 2 changes: no medication, no procedure. The second protective position is back sleeping with proper upper body elevation, meaning your entire torso raised between 15 and 30 degrees, not just your head. A wedge pillow achieves this correctly. Gradual upper body elevation allows blood to return to your heart efficiently from your lower body, reduces the intracranial pressure we discussed in number 5, and keeps your airway more open throughout the night, improving oxygen delivery to your brain. Pair this with a small pillow under your knees to preserve your spine's natural lumbar curve, and you have a position that distributes pressure evenly across your body while actively supporting cardiovascular function throughout the night. A second story. Harold, 76, had been sleeping on his back completely flat his entire adult life and described waking every morning with a heaviness in his head that took until mid-morning to clear. He had attributed this to age and to the blood pressure medication he had been on for several years, assuming the grogginess was simply a side effect he had to accept. When we introduced a wedge pillow, raising his upper body by about 20 degrees, the change in how he described his mornings was almost immediate. Within a week, he told me the heaviness was gone. Within 3 weeks, he asked his doctor whether his medication dose could be reviewed because he felt, in his own words, more like himself than he had in years. The medication had not changed. His sleep position had. A third story that illustrates how these habits can stack together without anyone noticing. Frank, 68, was not experiencing obvious symptoms at all. He came to me proactively after his brother had a stroke, wanting to understand what preventive steps he could take. We reviewed his nightly habits together. He slept on his right side, ate dinner about 90 minutes before bed most evenings, and occasionally had a glass of wine with that dinner. None of these things produced a symptom obvious enough to concern him. We worked through changing all 3, gradually, over about 6 weeks. 6 months later, his cardiologist noted that his monitored nighttime blood pressure readings had improved meaningfully compared to the previous year. No new medication, only his overnight habits had changed. Your bedroom environment also matters more than most people realize. Temperature first. Keeping your room between 64 and 68 degrees Fahrenheit supports the core body temperature drop your nervous system needs to enter deep, restorative sleep. When your bedroom is too warm, you stay in lighter sleep stages longer. Your heart rate never fully decelerates, and your blood pressure never drops the way it is biologically designed to drop overnight. Missing that protective overnight dip consistently, month after month, is associated with meaningful long-term cardiovascular risk that almost never gets traced back to bedroom temperature. Blue light from screens after 9 in the evening suppresses melatonin and delays your brain entering the deeper sleep stages where cardiovascular recovery and brain waste clearance are most active. A physical book, warm, dim lighting, or fully activated night mode on any screen is a small change with real overnight consequences. And noise, even sounds that do not fully wake you, triggers brief sympathetic nervous system activations that momentarily spike heart rate and cortisol. A white noise machine or earplugs prevent your cardiovascular system from repeatedly reacting to irregular sounds across a full night of sleep. Several questions come up consistently at this point, and I want to answer the most important ones directly. First, what if I roll during the night and wake up in a different position than I started in? Rolling is completely normal and not something to fight against. The goal is spending more of your total sleep time in a beneficial position than a harmful one, not lying completely still. A body pillow placed in front of you creates a passive physical barrier that makes rolling to your right or onto your back more effortful, which naturally nudges you back toward your left side without requiring conscious effort through the night. Second, is there a practical way to track whether these changes are actually helping? An overnight pulse oximeter, which clips to your finger and tracks blood oxygen saturation, can reveal whether your levels dip below 92% during sleep, which is worth discussing with your doctor if it happens repeatedly. Heart rate variability tracking through a smartwatch gives you a window into how well your nervous system is recovering overnight, and a brief morning log, rating mental clarity and noting headache presence each day, gives you personal, concrete evidence of change across weeks of consistent effort. Third, I have sleep apnea. Which position is safest for me? Left side sleeping is strongly preferred for people with sleep apnea because the airway is less likely to partially collapse in a side position than in back sleeping, even with elevation. If you currently use a CPAP or oral appliance, these devices work alongside any position. If you suspect you have untreated sleep apnea, that warrants its own conversation with your doctor, since it is an independent cardiovascular risk factor that position changes alone cannot fully offset. Here's your action plan for tonight. Choose one change from everything we covered. Left side sleeping with a body pillow. One properly contoured pillow replacing a stack. Dinner finished 3 hours before bed. A 15-minute walk after your evening meal. One change done consistently for 7 nights, and then pay close attention to what your mornings tell you. Headache frequency, mental clarity on waking, how long it takes to feel alert. These are the signals your body sends when its overnight environment genuinely changes. Most people never hear this information because sleep position does not fit into the framework of a standard medical appointment. There is no lab value for it, no imaging study, no prescription to write. In 12 minutes, your doctor is checking your labs, adjusting your medications, addressing your specific complaint that day. Sleep posture is not on the checklist, but the cumulative effect of 7 or 8 hours spent in a position that restricts circulation, elevates intracranial pressure, or adds unnecessary workload to a heart already working hard builds over months and years into risk that is real and largely preventable with information most people simply never receive. You now have it. Use it. Drop a comment below and tell me which change you are starting with tonight. And if this gave you something your doctor has never had time to explain, share it with someone over 60 who needs to hear it. That is what this channel is here for. I will see you in the next one.